Change has come to Hillbrow. In the heart of the Hillbrow Health Precinct stands Shandukani, a maternal and child healthcare centre. The word means change, and the 28 million rand CSI-funded development project will be exactly that for the mothers and children that will use the facility.
So the Shandukani project emerged from a bigger partnership between my institute, the Wits Reproductive Health and HIV Institute, and the university, together with the Gauteng province, the city of Johannesburg, and now the private sector as partners. This bigger project is to take building by building in a very derelict and rundown area and to restore them to their former glory, but to do it for health and development and poverty alleviation, for excellent services, for research, for training. So it's a part of a bigger project. WRHI's role in Shandukani was that we, if you like, project managed it. We took the vision to the province, to the city, shared the vision with them, shared the vision with the private sector, and then we were able to drive and coordinate that project. But we had enormous support from both our private sector partners and from the government sector as well. So it's really been a coordination effort, but it's been a tremendous partnership.
South Africa's public health institutions saw 750,000 abortions between 1997 and 2008. Change could not have come any sooner. South Africa's Minister of Health, Aaron Motsoaledi, spoke of the importance of change at the official handover of Shandukani Maternal and Child Health Centre.
And change is exactly what we dream of planning for the entire healthcare system in South Africa. We know there is a lot of skepticism about whether public health care will ever work. We need to reduce this maternal and child mortality. We can't be a country at this level of development, but still be counted among the many countries where maternal and child mortality is on the rise. The wife of our icon, President Mandela, an activist in her own right, and she mentioned a very strong statement. She said South Africa is the only country in the world where maternal mortality is on the increase, where maternal and child mortality is on the increase, when the country is not at war.
South Africa's dire maternal and child mortality rate has called for urgent action. The result has been a private-public partnership to ease the crisis.
We like the idea of a public-private partnership, and this project, Shandukani, met a lot of the needs that we wanted to accomplish through our CSI program. Doing something that really benefited the inner city was important to us, and then also obviously providing primary health care and centre of excellence to address HIV/AIDS was also high on our agenda, and this project is something that we're very, very proud of.
I think that from our perspective, it's about the people of South Africa. It's about some of the challenges that government has in terms of health care, and in particular HIV and TB. And Altech, as a corporate within South Africa, felt probably unfair to ask the government to do everything. It's important the private sector contributes with government in order to address what is a major challenge in our country, and it's about the people of South Africa, and that's why Altech decided it wanted to be involved in this project, and we contributed 14 million rand towards the project.
Hillbrow is the locality of this facility. With over 1 million residents and a high infant mortality rate, Shandukani is perfectly located.
You know, I used to come and sing and dance in Hillbrow in years gone by, and the area has been so neglected over the last 10-15 years that I think it just gives us such goosebumps for Hillbrow to take its rightful place as a centre of diversity in the city of Johannesburg, because people come from all parts of the world to Hillbrow, and they deserve the best.
The Gauteng Department of Health is on board with the national government's vision to re-engineer the country's health system and plans to take full advantage of the newly acquired facility.
Well, one of the things that we're going to be doing, working with the city of Joburg, in particular the Department of Health, is to ensure that we have outreach programs around the area. Firstly, to teach them about how do you need to conduct yourself as a teenager, especially a girl child, not necessarily taking fathers out, because fathers also play an important role. But secondly, what is also important is to ensure that people are aware of the service. But as they are aware of the service, they must actually protect the service, because it is their service. It's not the government's service alone, but it's a partnership with the community and the private sector.
The private sector shared some of their hopes for Shandukani.
We hope that the facility will be a center of excellence and that it will not only be of benefit to the community of Hillbrow, but spread its wings to the rest of the country in terms of world-class research, in terms of skills development, and in terms of providing a model from which we can build a better national health insurance.
It's fine to build a new building and do new theatres and deliver 30 babies a day and focus on HIV, but going forward, this building still needs to be maintained, electricity still has to be paid, and various other things. So sustainability is what we're talking about, and I think that's going to be key for the future of this facility.
Shandukani may just be the beginning of the transformation of South Africa's health system.